Good evening. Squeeze in. If you're in the hall, come on in because we are starting. My name is Patty Marsden, and I am the pastor of Newmarket Community Church, and I am a member of the Newmarket Alliance for Substance Abuse Prevention, and I want to, on behalf of all of us on the Alliance, and welcome you to this event tonight, welcome you to this opportunity tonight to listen and learn and engage and get in the game. The fact of the matter is we live in an amazing community, right? Yeah. Right? Yes. Newmarket is a great place to live. We love this community. We love our families. We love our children. We love our seniors. We love all those people who serve this community. And this great community, like many other communities around the seacoast, has a great problem. Heroin is here, guys. If you haven't read about it, if you haven't seen it, if you haven't experienced it yourself, I hope you're here tonight to learn the reality that heroin is here. We have an amazing group of people in this community. Part of what makes Newmarket great is we have a group of community leaders who came together this summer to say, we have a problem. To address the problem front on, we've created the Alliance, and because of the creation of the Alliance and those people on the Alliance, we're here tonight together. This is just the first in what will be a series of various opportunities for us to come together as a community, learn about heroin, put together more support services to address this problem, and hopefully prevent the continuance of this problem in this community. So for those of you that are on the Alliance, I'm going to ask you to just raise your hand. You'll notice there are people around the room with name tags on. So you can look around, look around. We got police officers, firefighters, we have first responders, we have business owners, we have concerned citizens, we have pastors, we have other church leaders, we have all sorts of community leaders who have come together to say, we have a problem and we want to help. So I'm going to encourage you tonight to listen. You have a card on your seat. That card is for you to write down any questions you have. No question is a stupid question. We've had lots of stupid questions in our meetings, I'll tell you that right now, and some of them I think were quoted in the newspaper. Thank you very much. There is no stupid question. Tonight is an opportunity for us to engage, to learn, to figure out what we can do as a community, and find ways to help. So you'll be hearing from a panel of different people here, community experts, people that are in the field, people that are dealing with this on a day in and day out basis, a recovering addict, who I'm really pleased and excited to introduce Kim Branch, who not only has she fought the big fight and won the battle, she is helping others, and we started the Heroin Anonymous meetings at Newmarket Community Church with Kim's leadership about a month ago. And the good news is that meeting is well attended. The bad news is that meeting is well attended. So again, I encourage you to participate tonight, to bring up your questions, to listen to the stories that you hear, and to get in the game. Many of you signed in with me at the mail list, which will put you on our Alliance mail list. If you'd like to join our team, we are looking for members. So please do consider how you may want to share in this work, help us solve this problem, and become part of a really, really great group of people. So I want to, again, thank you for being here. This is exciting. We weren't sure if we were going to have ourselves and two other people or a room. And to have standing room only, once again, says a lot about what a great community Newmarket is. So our first speaker tonight is Lieutenant Kyle True. And for many of you, you know him. He's been with Newmarket Police for 19 years, and 6 of those years he spent undercover working exactly on this type of issue of drugs. And really, he really is such a wealth of knowledge as he works in the community. And honestly, he gave me a list of all the things he's working on, and there's so many I can't really do it by memory. But I'm going to let him, most importantly, tell you some of the stories. Because each week as we've met as an alliance, we've started essentially each week with Kyle telling us a story. And it's those stories that have changed many of our lives and have made us passionate about the work that we're doing. So without further ado, I introduce Lieutenant Kyle True.
Patty, I was hoping you were going to talk about the things I'm doing because my boss is here and I want him to know how hard I'm working. He's still here, right? Good evening. My name's Kyle True. I'm a lieutenant with the Newmarket Police Department. I'm happy to see so many people here. I'm actually overwhelmed by this crowd. We were hoping if we would get between 20 and 30, and this is fantastic. And I thank you all for coming here tonight to discuss the topic of heroin and opiate addiction. I was asked to sit on the coalition back in August, and we welcomed myself and several of the officers that are sitting in the back here were asked to sit on the commission, and we welcomed it with open arms because we understand that this is not just a police issue or a fire department issue or a school issue. This is a community issue. We cannot go this alone, and we need the help of the community to make this successful. In my nearly 23 years of law enforcement, I've seen different fads of drug use come and go. For example, in the 1990s, I remember when crack cocaine hit us in the late 90s like a brick wall, and then it slowly subsided. The abuse slowly started going away. And then I remember in the early 2000s, we had the rave drugs, the ketamine, the ecstasy, MDMA, Rohypnol, and the abuse slowly started subsiding. And a couple years ago, the fad of bath salts started, and that slowly subsided and has gone away. I'm terrified of this heroin right now. I am not seeing any decline in it. In fact, I'm seeing an uptick in it, and it scares me to death for the community. The fact that I'm a dad of 2 girls. I'm just terrified of this, and I welcome any of you to join this coalition because we need all the help we can get. So let me just talk a little bit about Newmarket, what Newmarket's got going on. Since January of this year, we've had approximately 50 heroin or opiate-related calls for service. Approximately 23 of those have been overdoses. We had 3 overdoses since, I believe, Thursday. All 3 have made it, thanks to the first responders, fire department. Other calls for service that we have also include people finding hypodermic needles, heroin kits, tourniquets, and in a couple cases, people actually found bags of heroin on playgrounds, ball fields, and public ways, and they've turned them into the police department. Some of the other calls for service we've had are when we make arrests for heroin possession or someone selling heroin. There's a gentleman that you're going to hear tonight. He's sitting over here. His name's Chris Placey, and I just want to talk about him real quick. He's sitting on the panel. When I first met Chris at the beginning of the meeting of this coalition, he said something to us that has resonated with me, and I can't stop thinking about it. He told us all to, quote, become a student of this disease. And I've taken those words to heart, and I've constantly thought about that. And I've brought it back to the police department, and myself and my fellow officers have done everything we can to constantly educate ourselves about this disease. We're trying to figure out and try to improve how we deal with people with addiction. What are the signs of addiction? What starts them using? How can we intervene through the help of the court? Or how can we intervene with the help of a family member? Most importantly, how do we get somebody to treatment and then make sure that they have a continuum of care after the treatment is sought? I'm going to be turning the mic over to Tori Jennison in a couple of minutes, and she's going to give you a wealth of information on statistics in New Hampshire. But I want you all to know that this police department, the Newmarket Police Department, truly cares about this problem, and we're addressing it the best we can. We are here tonight to tell you that we will do everything in our power to work with you without judgment and by removing the stigma associated with this awful drug. If you need help, if you want help, we will do everything in our power to help you. It is not our goal to arrest people and lock people up and throw away the key. We cannot arrest our way out of the situation. We realize that. It's not going to happen. A statistic that was told to me by Chris Placey, which disturbs me to this day, is our largest in-house treatment center in the state of New Hampshire for opiate addiction is the New Hampshire State Prison. If that doesn't get you, I don't know what will. But also, it's, like I said, it's just not the police department. We need parents to be involved with their kids more. We need kids in school, young people, to be positive, to provide positive peer pressure to their friends. We need the school to address this also. I know we can get through this. I'm confident we can get through this just by seeing the faces in this crowd. This is overwhelming, and I know we can get through this. I am extremely proud to be a part of this. And I'm going to be turning the microphone over to Tori because I believe my 5 minutes is up. Sorry. But before I do that, I'm going to just thank a couple people who were very instrumental in making this thing happen. And if I forgot you, I apologize, but the list is very long. First off, Patty Marston from the Newmarket Community Church for opening her doors and allowing us in to have these meetings. Tori Jennison from the Seacoast Public Health Network. Chris Placey from the Governor's Council. Tony Weinstein, who's a community member and also a member of the Newmarket Town Council. Sue Gigliotti from the Lamprey Healthcare. Kimberly Branch, who you're going to hear tonight, who has a wonderful story and probably one of the strongest voices in our community with someone who's actually been down in the gutter and got herself back out. And I'm proud to have met Kimberly and stand behind everything you've done, and I think you keep continuing doing it. You're going to do a great job. Lastly, Eric Hawkins from the Seacoast Media Group has done a great job of getting this movement out, getting you people here. So thank you, Eric. And at this time, I'd like to turn it over to Tori.
They don't trust me with the handheld because they're afraid I'm going to hurt you. Good evening, everybody. Thanks for coming out tonight. There's no snow. You don't have an excuse, but we're glad to see you anyway. My name is Tori Jennison. I'm a nurse with the Seacoast Public Health Network. I'm the Continuum of Care Facilitator, which is a big, long name for the lady who makes sure that we're trying to get all our ducks in a row around substance misuse, around prevention, treatment, recovery. So as Lieutenant True mentioned to you, one of the first things that's really important is for us to recognize that we're all students of substance use disorders. We're all students of this disease. So one of the things that it's really important to do when you're a student is learn the language. I'm going to bore you to tears with some language and some numbers, and then we're going to give you an opportunity to talk to folks who can put names and faces to those numbers. And hopefully it will start to make some sense to you about exactly what the scope of this problem is that we're looking at and how we can start to tackle it. So I am a former Newmarket resident. I married a Newmarket grad. I lived on Grant Road. I lived on Main Street. And I was here when Wheelies was here. So that's the legitimacy you really need to hear. So let's see if we can work our way through here. Okay, so one of the first things that I think is really important, and forgive my backside, I'll try to stay out of the way, is what exactly is it are we talking about? We're talking about who? Who is it that we need to be taking better care of right now? In the 60s, over 80% of folks said their first addiction was to heroin. That makes sense. There weren't so many prescription pain pills in the 60s. It was only about 20% of folks said that their first addiction in the 60s was to prescription pain medicine. You will see these trajectories change. What happened here? We got really good at measuring pain and treating it. Really good. So good that in the 2000s, almost 80% of folks said the first opioid I was addicted to was a prescription. So now we're looking at about little bit more than 60% of folks are saying the first opioid I was addicted to was a prescription pain medicine. That's huge. That's a huge thing to recognize, that it is not everyone that's picking up heroin on the street, in the backyards, the back alleys that we don't have in Newmarket, that's suffering from heroin. Most everyone in this room has or has lived with someone who has had a prescription opioid medicine. That means you or someone you love has been at risk of having trouble. So how does this happen, whether it's a prescription drug or heroin? A couple of stages. It's important to think about your brain as an organ. You're using the drug, it feels really good. Pharmacology says it hits all those pleasure points in your brain like chocolate and napping. Then you start to need a little more than you needed before, because that's how our bodies work to protect us. We call that drug abuse. When you start to hit a tolerance and you need to have more to get the same outcome. In some settings, it's not abuse. It's perfectly clinically appropriate to need higher doses to manage your pain. But in many settings, it's the first sign that you might be headed into trouble. When you start to rely on those higher doses to do things that the drug is not intended to do, help you wake up, help you get to work, help you get through your day, we start talking about dependence. Guess what? Coffee, help you get up, help you get to work, help you get through the day. It is not necessarily a choice for folks who feel like, if I don't have a cup of coffee, I feel it. You do feel it. You're feeling caffeine withdrawal. Caffeine, in this instance, is a substance. When you get to the point where you are needing it to the level where you're dependent on it to do those things through the day, your body, your brain changes structurally. Those changes make it harder and harder to do the things you need to do and make the choices that are healthiest for you. This top picture is what happens in the metabolism of a patient in their brain when they are not using drugs on the left, when they are using drugs on the right. You see a change in the colors up there. That's a change in the metabolism, in the energy, in the work that's happening in the brain. This is what happens when you have a healthy heart and when you have a change in the heart metabolism of someone with heart disease. That's an organ with changes about how the organ works. Heart disease, substance abuse. So the numbers get a little bit scary, and really the most important one to look at, this is 2010, the other end is 2015, the blue line, all the deaths related to drugs in the state of New Hampshire. This comes out of Dr. Tom Andrews' office, he's the medical examiner. The red ones are heroin, the green ones are fentanyl. So all the drug-related deaths are going up, and the reason that if you add this and this, you may not get this. There are always some in here that are related to other drugs that aren't necessarily heroin or fentanyl, a small number of them, but some. Fentanyl, in the last 18 months, has started to be a huge reason for death for folks that are overdosing on opioids in this state, partly because fentanyl is profoundly more powerful than heroin, and even a very experienced heroin user can't tell you what amount of fentanyl is in the heroin they may have just purchased. So these are some numbers that are just high and scary, but we're going to talk a little bit about why they shouldn't be quite as scary as they look. This is based on old data, but the trend in this data is such that any of this, the way it looks now, is worse today. New Hampshire is the highest rate of 12 to 20-year-olds in 2011 that reported using alcohol in the past month. That says we're not doing a great job getting our messaging out to them about how harmful it is. third highest in the country, where 21% of youth 12 to 20 said, in the past month, I had 5 or more drinks at a time. That's a terribly dangerous activity. Terribly dangerous. Fourth highest among 12 to 17-year-olds, 4 years earlier than legally it's okay, where we had almost 9% of the kids that took the Youth Risk Behavior Survey in 2011 say, I have used alcohol to the point where I was dependent, or substances where I was dependent in the last year. And as we talked about in that first slide, where 60+% of folks get first addicted to prescription pain medicine, these are important numbers. We're in the middle here for the really young kids, the 12 to 17, but we have the 10th highest rate of youth 18 to 25, almost 13%, saying, yeah, I used prescription pain meds that weren't mine at some point in the last year. And we're starting to understand how we got there from here. So this is just a quick bunch of other numbers that the state of New Hampshire, Department of Homeland Security, believe it or not, collects information about heroin use emergency department visits. In the state of New Hampshire, we saw 346 of them between January and September. In Rockingham County, and we are second in Rockingham County only to Hillsborough County, which has Manchester and Nashua. We were second only to them in terms of heroin and prescription drug treatment admissions. That's very good news. That's very good news. We are seeing these folks, and to the best of our ability, we are giving them some care. And the best of our ability is not fantastic, but that's not a terrible thing. That number is good. What we'll talk a little bit more about at the end here is Narcan administration. This is Narcan that was administered by folks on an ambulance. In Rockingham County, between June and September, 171 doses of Narcan were administered. Often it takes more than 1 dose for one patient. Even if it takes 10 doses, which it never does, that's a lot of Narcan. It's a lot of Narcan and a lot of people who need it. So this will kind of back that up, that in Rockingham County, we were giving 36 doses in the ambulance in July, 49 doses in August, 46 doses in September. We are second to Stratford County in that regard, and Hillsborough, by and away, blows the rest of us away. So this has been your first class on substance use disorders, on who it happens to, which is all of us, who's at risk, every single one of us. The numbers back that up. And hopefully, as we talk a little bit more about the experience folks have and the resources that are available to you and what we're doing in Newmarket to change some of these numbers, we can answer some of your questions as we move forward about that. So I will ask that we'll hold questions till the end, where we're going to have a chance to meet the expert panel and some of the other folks that are speaking tonight. But you do have some index cards and pens at your seat and other paper. If you have questions that come up as you listen to us speak, please write them down. Because if we can't answer them all tonight, we will collect them and make sure that we do get them answered, folks. Well, I think it's my job to introduce the panel to you. And as folks have referenced, it really is a really stellar group of people that have participated on this Newmarket Alliance for Substance Abuse Prevention. I will tell you, I've worked with community coalitions up and down the East Coast for 20 years. I have never seen one move this fast. Painfully fast at times. As folks will tell you, we're all so excited you came because it was a lot of work and a lot of hard work and sweat and tears to get to this point. But I really do want to encourage you to recognize the folks who are Newmarket residents who have done this for you. Chris Placey is Chris is a Newmarket resident and a small business owner for the Substance-Free Workplace and Mobile Drug Testing, as well as a public member of the New Hampshire Governor's Commission for Alcohol and Drug Prevention, Treatment, and Recovery. He does dedicate much of his time to educate parents and the business community on drug-free workplace and recognizing signs and symptoms for substance use issues. Chris has been the subject matter expert at the table on so many things with this community coalition, and it's really fantastic that he's joining us tonight. Jeremy Adams. Jeremy has promised he's not doing karaoke, so we'll keep our fingers crossed. He is the owner of Jeremy's Pizza, and he is here tonight representing the Newmarket Business Association and as a Newmarket resident who's concerned about his friends and family.
Two hands.
So Mike Pelzar, I mean, everybody knows Mike Pelzar. My grandparents know your grandparents. That's how much everybody knows the Pelzars. Mike's an EMT with Newmarket Fire and Rescue. And Kimberly Branch is a Newmarket community kind of member for going on 6 years now. And she was the founder of Heroin Anonymous in Newmarket. That's huge. That's huge. And I want to make sure that you know how huge that was. We had only been meeting for about 3 months now, I think. There are 3 Heroin Anonymous sites in the state, aside from Newmarket. It just doesn't happen that you go from, I'm here, what do you need? And it's done in the 3 weeks it took Kim to do it. So you couldn't have a better cross-section of the folks who live among you to talk to you about their concerns tonight. And everybody's got a couple of minutes to share some of their concerns and their observations, and hopefully if you have some questions for them at the end, we'll make that happen too. Kim?
Hello, my name is Kimberly Branch. I have seen the effects of addiction firsthand my entire life, from my father being heavily addicted to opiate-based pain medication to my own heroin addiction, my stepfather's alcoholism, multiple friends who have used, abused, died, or landed themselves in jail. Heroin affects me whether I'm using it or not. With this epidemic, I'm still watching addicts use, abuse, and suffer. I'm still losing friends to death. I have people come into my work every day, messed up on drugs, and it really breaks my heart. I want to reach out to them and help, but it's always a matter of them being ready to listen. There is always another way. You can have serenity too. I'm amazed at how the Alliance for Substance Abuse Prevention has come together. We are all from different walks of life, yet we have one common goal: solve this epidemic in our town. Thus, a community who works together, things get done. I am proud to call this my community, my home. You should too. Let's work together. Thank you.
Good evening. My name is Michael Pelzar. I'm an EMT for Newmarket Fire Rescue. A lot of things have changed drastically in the EMS world in the past 5 years. We used to receive 911 calls for a young, unresponsive patient barely breathing, and we'd automatically think, oh, that's a diabetic problem. Well, upon arrival, we noticed it was a diabetic problem. Nowadays, unfortunately, this has become a common call. It's a call we refer to as a possible drug overdose. I'd like to take a couple minutes and address 2 issues I have with these calls. Please, if you call 911 for a loved one or a family member, when we arrive, please tell us everything you know. We walk into homes 3 o'clock in the morning and there's a lot of blank faces and people just aren't telling us the truth. We need to work together. You heard Lieutenant True earlier, nobody's gonna get in trouble. Please start talking. We need to change the way we do things, and it's time to talk. If you really have a friend that needs help, you need to work with us to give them the best chance of survival. Narcan can do a lot, but we need to know all the facts and the circumstances surrounding it. Another piece of info, I know Narcan is making it into a lot of people's hands. in different areas other than the EMS world. If you're at a residence or anywhere and you're about to administer Narcan, please do me a favor, call 911, just in case. I have many patients that need multiple administrations of Narcan, or we need to secure a healthy airway and keep it open. And just because you have a little vial of Narcan doesn't mean it's going to work. So please call 911. It doesn't hurt. Even if we arrive and you tell us everything's fine and the individual standing at the door, we'll go home. But I just want to make sure, just in case, rather have too much people come in, too much help than not enough. And remember, we can only help if we're called. Thanks.
Which one? Hello? There we go. Hey, everyone. I just wanted to share some personal and some business events that have happened around Newmarket lately. There's a lot of people that think that heroin hasn't arrived in Newmarket, that it's not us, it's not our kids, it's not our family, it's not our friends, it's not our coworkers, it's not our employers, it's not our employees. This is, it really saddens me to have to tell you this story, but I just want to let you all know because it is in Newmarket. I've experienced it firsthand, and a lot of people around here have. Sorry if you've already heard the story. If you're one of my friends that I've already told, you can hear it again one more time. This summer, I think it was late July, me and my son were outside, and I walked around the corner around Central Street. If anybody knows Central Street, it's the street that's in between Cracked Skulls and the new tattoo parlor, directly next to my restaurant. And I walked up Central Street. It's a one-way coming down, and there's a dumpster there, a green dumpster. And right through the alleyway right there, you can see my restaurant, inside my restaurant, and it's where I keep my kids' bikes for when they're riding around town in the summer. And we went around the corner, went up to the dumpster. I was just about to go through to get the bikes, and there was needles, syringes, spoons, tie-offs, all right on the ground, right where my kids walk, right where I walk, right around the dumpster, which means many things to me. It means that somebody was just using recently within eyesight of me. It means that my kid could have picked that up and poked themselves, picked that up and got infected in some certain way. It means that my child could have found it. One of my children, 8, 3, and 1, one of them could have found it. And then August, right before school started, one of my employees came to me and told me that they found a syringe in the trash in the bathroom of the restaurant. Now, if you know me, you know that I'm the guy that always lets everybody use the bathroom whenever they need. Most businesses you need to buy something, or they just don't let anybody use the bathroom. I just don't care and let everybody use the bathroom. So that's come back to bite me. We've since, after trying to just pinpoint the people and decide which people we were going to let use the bathroom and which ones we weren't, was more stereotyping than anything. So we decided that if you weren't buying something, you couldn't use the bathroom, which is not my style at all. If any of you know me, I would let anybody use the bathroom. I don't care where you're from, what you look like. If you need to use the bathroom, you don't need to buy something in order to use the bathroom. So long story short, we had a meeting with my employees, and we thought of what we would do, what way we would go about it, whether I'm in charge of deciding who uses the bathroom. The manager at the time is in charge, and we just decided to out with it. Somebody had come in and either used heroin or dropped off their dirty needle or syringe or whatever it is inside the bathroom of my restaurant. Then it was brought to my attention by my employees and a couple other people who heard the story that what if it was a customer? Not just, what if it was a customer that was waiting for their food and went in and used? That's how serious this disease is getting. It's affecting me directly. It's affecting my business. It's affecting my personal life. I have a best friend that's in jail from using heroin and dealing and stealing, and I have another best friend that, or another good friend that is in Mass General right now as we speak. And what I've learned is that heroin is everyone's problem, not just if you have someone in your friends, if you have someone that your family using. And I just also like to say to everybody that came to the meeting, thank you. And I hope that everybody comes to these meetings and it's not just a one-time shot, because with a group like this started, we can really tackle it. And I'd just like to thank everybody for coming, and I appreciate it greatly. Now let me turn it over to the professional, the one who knows the real stuff, Chris Placey.
I don't know how much I know, and whatever I know may not necessarily be a good thing. So anyway, thank you all for letting me speak here tonight. I want to first thank the people that started this whole thing, because it's sorely needed, and certainly it's here in my town that I actually have lived in since 2010, so I appreciate all the work that they do. I'm from Colebrook originally, scary enough, if you know where that is. Lots of things going on up there as well. But I'm here to talk about maybe more globally, or all of New Hampshire, some of the things that are going on. And I'm only going to talk about the truth. I'm a big believer in science and statistics and what's proven to be effective. I'm not interested in talking about something that's not research-based or doesn't have any foundation at all. That's just somebody's idea. Let's try that because it just might work. Historically, that's what we've done. If you think about it, in the 1980s, we realized that there was a drug problem in the United States, and we started, through Ronald Reagan's initiative, the war on drugs. It's been a colossal failure. Because the point of the matter is, and Officer True said it tonight, law enforcement can't possibly arrest their way out of this issue. Because we didn't really understand it. And as he mentioned that I've told everybody to be a student of this disease, I am asking all of you tonight to be a student of this disease. Because if you don't understand this disease, you will never have the ability to fix it, because it's so complex, and you need to continually learn stuff like I do on a daily basis about what addiction is, what causes it, and what might possibly fix it. The American Association of Addictive Medicine just redefined addiction in September of 2015. Think about that for a second. They just redefined it as a primary chronic disease. And we all have to understand that it's a disease. And if we all understand it's a disease, we need to use a disease model to fix this disease. Because punishing people and incarcerating them will never be the answer. And we all need to understand that. So let's not make the same mistakes going forward. We need to not just punish people as a solution to a disease. Can you imagine if you or one of your loved ones had cancer or diabetes, and our solution was to punish you? You would all be like, oh my God, how are you possibly doing this? This disease is no different. And we need to change our thinking so that we can possibly come up with solutions to not only help the heroin epidemic, but all addiction, whether it's alcohol related or whatever. I just want to talk about a few other things, and then we'll get on with the thing that I think is important. Not just the heroin epidemic, but why is drug and alcohol addiction in New Hampshire as bad as it is? Because we're not doing very well. I sit on the Governor's Commission, and I know that, amongst teens and young adults, we always rank in the top 5 or 6 for usage rates. Take alcohol, for example. Your 12 to 20-year-olds is first or second continuously is usage rates. And if you look at the Youth Risk Behavior Survey, New Hampshire students say that about, and I'll get the exact stat so I don't misquote it, 72.4% of their parents would say that alcohol is a harmful thing to do. The national average is 90.2%. In other words, almost 20% less New Hampshire students think that their parents think it's unhealthy to drink alcohol on a daily basis. Marijuana is similar. The stats for that, about 70% of New Hampshire students think it's unsafe or unhealthy to smoke marijuana, and about 90% on a national average think that. So in other words, the message that they're getting from their parents is not what they should be getting. certainly not what the rest of the country's getting. And I'm not here to say, boy, New Hampshire's not doing this, not doing that. I'm just telling you the realities of it. We need to set better messages to our kids, not only just in heroin use, but drugs and alcohol, marijuana, all of it, so that kids start to understand that it's not a healthy thing to do. And it's not about yelling and screaming at them. If your son or daughter comes home and thinks, and you think they got a drug or alcohol problem, they've used drugs, don't yell and scream at them. Give them a big hug and say, I love you. So, New Hampshire, we're not doing very well, and we need to change some things. One of the biggest things that's come across to New Hampshire that's going to be great is Hope for Recovery. I don't know if you've seen that, but the recovery movement is just awesome. It starts to address the issues of helping people on an individual basis, to see them as people with a serious problem, and do whatever they can do to fix the problem. So the last thing that I want to say is remember this whenever you're dealing with somebody who's got a drug or alcohol problem. It's not a matter of will. It's truly a disease. And not one of them wakes up someday and says, I think I want to be a heroin addict because that's a good idea. Thank you.
Thank you, everybody. Thank you for those perspectives and for that inspiration and food for thought. I do want to introduce our next speaker, Jim Michaels. He works for the Seacoast Mental Health, and he is a dual licensed clinical mental health and master licensed alcohol and drug counselor, which is a whole lot of expert for that big phrase. He works at both Exeter and Parkland Hospital as an emergency services clinician. He does also treat severely and persistently mentally ill clients with co-occurring substance abuse problems, which is about as complicated as it can get. He has seen firsthand the devastation to people, their families, and the communities that illicit substances cause. So he's going to share with you tonight some of the signs and symptoms of opiate abuse, what to look for. So, thank you, Jim.
So everybody should have a handout. If not, we may have to share some, because I only brought 100. I apologize that I probably had to overly simplify a lot of this stuff so I can squeeze it within my time limit. But what I wanted to start with is, if you've got the handout, there's 3 questions that I've asked in every emergency room I've ever worked in. I started my career actually up north. I worked for Northern Human Services in Littleton and Groveton and Colebrook, and covered all the hospitals north of the Notches, and I've been down here for 3 years. And in all of those hospitals, these are the 3 questions that I'm asked whenever there's any sort of drug, is what did we miss? Parents believe it's my fault. And then why can't they just quit? Why can't they just stop using? Okay, so I want to answer those real quick. What did we miss? If you're a parent, you missed absolutely nothing. Nothing. Because what parents lack with our kids is objectivity. If you have a child and they're in your home, you don't see their microscopic growth every day, the millimeter that they grew every month. I have a grandson. I have 5 grandchildren, and I just had a grandson a year ago. And he lives actually up in Jefferson. And I get to see him every 4 or 5 months. And the first thing I say when I see him is, wow, look at how he's grown. But his mom and dad don't see it. And it's the same thing with drug addiction, is that it's so slow and minute in its parts that it goes from 0 to 60, and you say, what happened? So it's not, you didn't miss a thing. But listen to people who have objectivity. Maybe there's an aunt that says, I see something, or a teacher, or grades, things like that we can add objectivity to us as parents. The second thing is that it's my fault. First of all, it's not your fault. Unless you're the one shooting it into their arm, it is not your fault. Okay? You as parents or family members are responsible for the environment that you create for your child to grow up in. But your child, your family member, your friend is responsible for their own actions. If we rob them of that pain that is caused by their own actions, they will not change. Because pain is a motivator to change. And if we always say, oh, it's my fault because we've taken the pain away from them, so they can always say, oh, it's mom and dad's fault. And until the addict can take responsibility for their own behavior, why change it? Because it's somebody else's. So we have to allow them to experience that pain. And then why can't they just quit? Just below where that third question, I have a quick thing of Maslow's hierarchy of needs. This is an entire seminar, so I'm going to make this in just like a minute. Is that when you are addicted, the very first bottom, it says physiological. These are needs: food, water, shelter, things that we need to live. Without them, we will die. Okay? What happens to the addict, the person who's truly addicted to a drug, is it becomes a need. And that everything higher up, safety, love, esteem, self-actualization, never can be found in their lives because they're always stuck in a place that the need is never met. Every addict that I've ever met in the ER is, all they can think of is, when's my next fix? When's my next fix? When am I going to get out of here? When can I get? It's like being hungry all the time. I need to eat, I need to eat, I need to eat. Nothing else matters. It's the same thing. So why can't they just quit? They can't. It'd be like, I want everybody right now just to stop breathing. That's what you're saying to them. Stop breathing. Stop doing something that you believe you need to live. So we just need to lose that from our vocabulary and help them to get out of the place that they're stuck in and into recovery, and to begin to experience safety, love, belonging, esteem, and self-actualization, which is a sense of who I am and how I'm productive in this world. So we're going to look at some warning signs here. Now, when we look at them, please be mindful that any of these symptoms left to themselves can be something other than a substance abuse problem. Okay? For instance, how many of you have teenagers? You ever have a teenager slam a door, lock you out, get angry for no reason whatsoever? Sometimes they just do stuff for no apparent reason. So please don't go home, take this list, and said, Jim, with all those letters behind his name, said, look, you're an addict. No, they're a kid. Okay? But if we miss this stuff, we might miss something really, really important. If you get nothing else from what I have to say tonight, have the conversation. Ask them. It's not hard. You doing drugs? I mean, every family's different, but you've got to ask them. If you'll never ask them, you'll never get the answer. And please don't be afraid of the answer. Ask them, ask them, ask them, ask them. Do not hold that back. It's amazing to me how many parents have come to the ER, and one of the questions I ask parents is, have you ever talked to your kids about drugs? Oh, no. Why not? Well, I didn't think it was a problem. Apparently it is. Now, I'm not saying that to be mean, but have the conversation, please. Your kids need it to stay alive. Not having the discussion is potentially dangerous. I had a person in the ER, this was just recently. They brought in their child, and they said, we want you to help our son get into a treatment program to stop using drugs. Okay, so I interviewed both the parents and the child. I interviewed the child, and one of the things I asked is, where are you getting the drugs? And the kid said, from my parents. From the parents. Problem. Who needs the treatment? The whole family. I forget who said it here today, but we're all affected. Whether it's the parent giving it to them or whatever, is that based on the theory that we're all connected by no more than 6 steps of separation, you're no more than 6 people away from somebody who's involved in an addiction, who's in a family. We're all affected. Legal, our resources at hospitals, it's amazing. And we walk around like it's not a problem. It's not my problem. Yeah, it is. To every single one of us. My hope is that the warning signs that I share with you tonight will at least spark the discussion concerning substance abuse with your loved ones. And one other thing. This is just from my ER perspective. There is absolutely no difference which socioeconomic class you're in, what age you are, or sex that you are. The oldest addict that I've treated was in the 90s, and the youngest one I've treated is 10. It doesn't matter what sex you are. Addiction doesn't care about what classification that you may put yourself in. From the richest to the poor, to the working, to the unemployed, does not matter where you live, is that we are all susceptible to an addiction. It's amazing to me how many times I've heard how can this happen to me? It can happen to anybody. We need to protect ourselves against it. I'm diabetic. Somebody had mentioned diabetes. It's not going to go away, but I can treat it. I can control it. And if addiction is a disease, which I believe it is that it requires us to be cognitive, to do something about it, to change, so that we can beat this thing and that people can live lives to what I call their divine potential. So let's take a quick look at some of these warning sounds. I've broken them down into 3 categories. Once again, please don't pick out one and say, oh, look at that, but look at them as a whole. So the physical and health warnings of drug abuse. Eyes that are bloodshot or pupils that are smaller or larger than normal. One of the first things that I do when because as they mentioned, I treat co-occurring disorders, is I tell a person when they come into my office, say, okay, look me in the eye. Because if they got great big black eyeballs or they got little pins, we got something going on, either neurological or the using. Sudden use or possession of eye drops for no apparent reason. Frequent nosebleeds could be related to snorting drugs, meth, cocaine. Snorting heroin is huge. They mix it with things. And of course, often this causes nosebleeds, changes in appetite and sleep patterns, sudden weight loss or weight gain. You're probably seeing that a lot of these can relate to just kind of growing up, but when they all start to come together, seizures without history of epilepsy, deterioration of personal grooming or physical appearance. There was a person that I treated 4 or 5 years ago, and thankfully today she's clean and in recovery. But for about a year, she really struggled with it. And I saw her weekly, almost other than holidays. So I probably saw her 40 times in a year. And at the end of our treatment, she said to me, how come you always knew when I was using when I came to your appointment? And I said, because those are the days that you had the floppy old T-shirt, you didn't take a shower, and you wore sweatpants with flip-flops. Just the way they change. You can see it when they're using, especially heroin, because heroin gives you I don't cares. You just don't care. You don't care about what you look like. You don't care about anything. And it shows in our appearance. So deterioration of personal grooming or physical appearance. Injuries, accidents, and person won't or can't tell you how they got hurt. Unusual smells on breath, body, or clothing. There's a house that I go to as part of the ACT team for Seacoast Mental Health. I can actually go into people's houses. And there's a particular house that I go to. When I come home, my wife knows I've been there because I pick up the smell. Shakes, tremors, incoherent, slurred speech, impaired or unstable coordination. These are some of the things that we need to look out for in the physical realm. In the behavioral signs of drug abuse is drop in attendance and performance at work or school, loss of interest in extracurricular activities. Often I'll ask in the ER is, was there ever a drop in your grades? Was the person ever involved in like Little League or sports, and did they stop? And often we can trace it back to is that's when they began to use drugs because drugs became more important to them than these other things, okay? Skipping classes, declining grades, suspension or detentions. I think this is a good place to say, what happened? Something did. Complaints from coworkers, supervisors, teachers, or classmates. This is the objectivity part. If somebody says to you, I see something kind of weird here, don't blush them off. And yes, we should defend our kids, but we should also let people speak into our hearts and give us some objectivity. Unusual or unexplained need for money or financial problems, borrowing or stealing, missing money, valuables, or medications, both prescribed and over-the-counter. This one I think I highlighted in yours. Tylenol is one of the most frequent overdose drugs that we see in the ER. How many people have Tylenol in your cabinets unsecured right now? You can die from Tylenol. It is an ugly, ugly way to die. And yet kids know it, they use it, and they'll swallow the entire bottle. And often we don't know it. They'll come to the ER, nearly comatose, and until we can get the test back, which takes an hour, so now we've wasted an hour to find out that they're toxic, and nobody ever thinks to look in your own medicine cabinets. So be careful of what the things that are there. If your child becomes silent, or family member, silent, withdrawn, engaging in secretive or suspicious behavior, sudden change in relationships, friends, favorite hangouts, and hobbies. Okay? And then I put, once again, highlight, yes, it's important to know who your loved ones are hanging out with. How many have had an argument with your kids about your friends? God bless you. We should. Frequently getting into troubles, arguments, fights, accidents, illegal activity, demanding more privacy, locking doors, avoiding contact, and sneaking around. Now that one there, that's just being a kid. So don't just pick out that one, but like I said, these are all things that we need to piece together. Change in dress and hygiene, okay? Where's my timekeeper at? Oh, there you are. How much have I got? Oh, good golly. Psychological warning signs. Unexplained change in personality or attitude. It's amazing to me that by the time it gets to the ER, that's the worst day in a family's life. And the family, this is what they'll say to me, what happened to my kid? What happened to them? Sudden mood changes, irritability, lethargic, angry outbursts, overly calm, depressed or elated. Somehow the behavior doesn't fit the setting. I knew an addict that actually had gone to a funeral and laughed during the eulogy. That just doesn't fit. Periods of unusual hyperactivity or agitation, lack of motivation, inability to focus, appearing lethargic or spaced out, appearing fearful, withdrawn, anxious, paranoid for no apparent reason, psychotic delusions and hallucinations. I don't know how much we know about spice, but spice is there. It's not going away. It's fake pot. And the reason that fake pot is accelerating is it's not picked up in any drug screens, and if a person's on probation, they can smoke spice and become crazier than a loon, and nobody will ever know it. And it's the hardest thing for us to determine in the ER, unless they will actually answer the question. So if your kids come home with kind of a weird smell, or you find stuff that's potpourri, chuck it, burn it, get rid of it. Because spice is out there, and people are getting hurt because of it. Very important, no, any of these warning signs taken by themselves, recurrent theme here, can simply be related to something other than drug use. If you see these problems, it's always important to have the conversation. Silence is deadly. And in this last part, I just put some common warning signs of commonly used street drugs. Marijuana, glassy red eyes, loud talking, inappropriate laughter, followed by sleepiness, loss of interest, motivation, weight gain or loss. If my mom had only recognized that I was eating 2 boxes of Fruit Loops a day, she may have saved me a whole lot of problems. Depressants, including Xanax, Valium, and other central nervous system depressants. Contracted pupils, drunk-like, difficulty concentrating, clumsiness, poor judgment, slurred speech, and sleepiness. Most of the kids that I see that overdose on benzodiazepines are getting them from somebody in their family out of their medicine cabinets. Stimulants. The amphetamines, cocaine, crystal meth, dilated pupils, hyperactivity, euphoria, irritability, anxiety, excessive talking followed by depression, which is the crash, excessive sleeping at odd times, may go long periods of time without eating or sleeping. Inhalants, glues, aerosols, vapors, watery eyes, impaired vision, memory and thought secretions from the nose or rashes around the nose and mouth. There was a... what's that TV show, the addiction thing? My Weird Strange Addiction. There was a person that was actually addicted to smelling Pine Sol. So nearly anything that you can sniff can fall into this category of an inhalant. Hallucinogens, LSD, PCP, mushrooms, they're still out there. Dilated pupils, bizarre and irrational behavior, including paranoia, aggression, hallucinations, mood swings, detached from people, absorption with self and others, slurred speech, and confusion. Heroin, contracted pupils, the pinned eyeballs, no response to pupils to light, needle marks, and needle marks aren't just in the arms. If your kids, if it's 85 degrees outside and they're wearing a long sleeve shirt, or they refuse to take their shoes off, because the place that I'm finding in the ER they're shooting up the most is in the feet, because you can hide the arms. Or you can't hide the arms, but you can always hide your feet. So don't be afraid to look. Sleeping at unusual times, sweating, vomiting, coughing, sniffling, twitching, loss of appetite. Any of these things, look for them. Often we don't see it because we're not looking or we're afraid to look. Don't be afraid to look. And then maybe tonight you recognize yourself in the following signs and symptoms of substance abuse and addiction. If so, consider talking to someone about your drug use. And any of these things that I'm about to mention to you apply, then drugs are a problem for you. that you're neglecting your responsibilities at school, at work, or at home. If you're flunking classes, skipping work, neglecting your children. If you're using drugs under dangerous condition or taking risks while high, such as driving while under the influence, using dirty needles, or having unprotected sex. If your drug use is getting you into legal problems, such as arrest for disorderly conduct, driving under the influence, or stealing to support your drug habit. If your drug use is causing problems in your relationships, such as fights with your partner or family members, an unhappy boss, or a loss of old friends. These are really general questions, but if any of these apply, and the reason that these things apply is because of drugs, your drug use by definition is a problem. I've treated hundreds of people with substance abuse disorders, and I've seen many become clean and sober, leading productive lives. It's never too late, and there is always hope to help those who want it. Now, I just want to say one more thing. In my office, I have, how many people here remember Gumby? I have a Gumby in my office because drug addiction and drug treatment cannot be pigeonholed. Everybody's different. And the avenue, the path that we take to recovery will be different for everybody. We have to be Gumbies in this on both sides of the aisle. The addict and the treatment providers have to be flexible. We have to bend. We have to do whatever we have to do, twist, turn, squished, without breaking, and that we can see recovery, we can see this heroin epidemic stop, just as the officer talked about in the past, the different things. We can see this thing, but it's going to require a community, it requires the family, it requires us all working together to see this come about in our community. Thank you.
A lot more about some of the things you heard from Jim when we get to the question and answer section. I do want to wrap up our expert speakers tonight by introducing you to Heidi Moran. She's a master licensed alcohol and drug counselor with her master's in social work. She's worked in the field of addiction for 20 years. It's a lot of expertise about what's worked. She's currently the clinical administrator for Southeast New Hampshire Drug and Alcohol Services, and she's going to talk appropriately at this point about what some treatment options are, because our goal for you to walk away tonight is understanding that treatment doesn't only happen when you hit the point where you're deeply suffering from addiction, that there are many points when you're using, misusing, abusing, or someone you love or related to. Hopefully, if you're related to them, you love them as well, but I won't make that a deal breaker. That there are many different levels of treatment, and Heidi's going to talk to us about what they do in Southeast New Hampshire.
I must say that I'm very impressed. I'm very impressed with the size of the group here. I've spoken to, I would say, 6 or 8 different audiences over the last year in similar venues, and this is by far the largest. Unfortunately, as I was sitting over there, I was doing a little bit of calculation in my head. And if my agency were to provide residential treatment for a loved one or a friend of each person in this room, it would take a couple of years to get them through our treatment program. And that's a 28-day program. And the bottom line is there's not enough treatment in the state of New Hampshire. There's definitely not enough treatment available right now. The people in Concord are working to change that. It's becoming more and more apparent, the need, and there is hope that things are getting better. My agency, Southeastern New Hampshire Services, is in Dover, and we provide a full realm of treatment services, everything from Stratford County Drug Court program to a women's intensive outpatient program, outpatient services. We have several counselors that will counsel anybody that seeks services. And then we have the 28-day rehabilitation and a 90-day halfway house. Up until just this last month, we had to reduce our beds down to 10 beds from what we had at one time, 12 to 14 to 10 in our 28-day, and from 18 to 20 in our halfway house down to 15. But because the people in Concord and other parts of the country have been working so hard to try to make changes, they've allowed us to increase our bed numbers again. So now I'm up to 12 and 16, which is better, and that's just happened in the last couple of weeks. We're not a medical facility. We're not a psychiatric facility. So in my particular programs, we do an intense screening of clients that want to come in and get treatment. The process is if somebody wants to have a bed, if somebody needs a bed and they've gotten to the point where they want treatment, they call on the phone, they do a telephone screen, they provide us with all of their demographic information, their medical history, their legal history, their psychiatric history, their current health history, what medications they're on. And from all of that information, we determine whether or not we're an appropriate fit for them. It's not a matter of whether we want them to come to us, which is something that I find over and over again. Family members will call and they're so desperate. Why won't you take my son, or why won't you take my daughter? And it's purely a matter of safety. We're at the point now where we have so many people on our waiting list that we have to triage. We have to look at the people that we can best serve the quickest and in the most appropriate and the safest way. We have a lot of clients that are trying to come out of jail that have been incarcerated for drug offenses. A lot of them have had to detox in jail, which is a horrible thing. And we have caseworkers from all over the state of New Hampshire calling us looking for beds for some of these inmates. If somebody has had 3 or 4 months continued abstinence, even if it's in jail, and then I have 12 people that are out on the street that are still using drugs on a daily basis and are still living under a bridge or wherever, I have to go for the people that are of the greatest need right now. At least the people in jail are safe at this moment. The person that's out in the cold or that's injecting with dirty needles or is in somebody's bathroom, that person isn't safe. So on a daily basis, we're trying to do the best we can with what we have to work with. My agency is the only residential in the Seacoast area, so it's quite difficult. We only handle 18-year-olds and up. We don't have a place for children, for young kids, which again is a horrible thing. It's not because we wouldn't like to be able to treat them. It's because we don't have adequate resources or space. Obviously, we can't have 14-year-old kids in with 30-year-old men that just came out of prison, you know? So it's a problem. It's a problem where people can seek treatment. I agree with so many things that have been said here in that education is a primary. And when our clients come into treatment in the 28-day program, they receive education about the disease, they receive education about their emotions, they receive education about how what they've been doing has affected their other family members. We also provide family education once a week. The family's invited in, and we do a 3-hour family education program every Sunday so that the family members of our clients also get to learn what's been going on. They learn about relapse. They learn about 12-step recovery programs. They learn about what they can do and what they can't do, and what it means to be able to let go, and what it means to support. I was also very happy to hear about the other substances, because I think heroin has been such a daunting thing here for the last year or so that people have forgotten that alcohol is a drug, that all of these other substances that were mentioned are drugs, and we have to keep an eye on those as well, because granted, we do have probably, right now with the people that I have in my facility, probably 80% are heroin addicts. And I have 15 in the halfway house and 11 downstairs in the 28-day right now as we speak. And I do have a couple of people that are alcoholic, but all ages from 18 up to, I think the oldest person I have right now is 66. So as was said, there's no discrimination, age, sex, socioeconomic. It doesn't matter. Time? 2 minutes. Okay. Our programs are tough. They're very structured. When people come into our facility, they're often in shell shock a little bit because we don't allow them to watch TV. We don't allow them to read the newspaper. We don't allow them to read magazines. They can have 4 phone calls a week. 2 of those phone calls have to be made to family members or loved ones. The other 2 can be, or to people in recovery. The other 2 have to be to people in recovery. And the purpose of this is for us to help our clients build a sober, clean and sober support network prior to their leaving treatment, and get them connected with people in the community that are actually already working recovery and are already out there and succeeding, so that they have somebody to call and to connect with when they leave treatment. We have a lot of rules. People can't wear hats in the house. People can't chew gum. They can't talk in the hallway. The men and women are segregated as much as possible. That's a tough one. It's a co-ed facility. That's always challenging. And if you go over to the Stratford County Jail, we're located in the Stratford County complex, which makes it very convenient. And if you go over to the Stratford County Jail and talk to people that are on one of the pods over at the jail, and they've already been through our program, if they went through our program and finished and completed successfully, and they got a taste of what recovery is all about, they'll have glowing remarks and say, you have to go to Southeastern. Southeastern is where you need to go. If they were discharged because they were breaking rules, or they hooked up with a girl or whatever, and they had to leave, and maybe their probation officer came over and walked them across the parking lot back next door again, they're going to tell them, you don't want to go there, you don't want to go there no matter what. So We've had to condense a program that at one time was 8 weeks in length to now being 28 days in length. And we worked very hard to provide the same quality of services and the same amount of education and support that we provided when it was a longer program. And again, the number one thing is anybody that can help to support, to promote getting more beds in this state. That's what we need. Thanks.
We have reached the very exciting part of the evening where you've heard from us, and now we want to hear from you. So we have a few minutes to take questions from folks if you have them. If you're not comfortable speaking in this forum, please write your question down. If you hold it up, we'll have folks come around and pick it up from you, and we can read it for you. If you have questions that you aren't comfortable doing either of those things with, hold on to your index card with your questions, and we'll collect them from you at the end, and we will make sure that we get them answered and published as well. Is there anybody that has questions for any of these folks tonight? Sure. Please introduce yourself, if you're comfortable.
Sure. I'm David Bono. I'm actually a primary care physician in Portsmouth, and thank you all for coming to talk. That's awesome. Just as a lead into my question, as a physician, I'm kind of surprised at how infrequently patients come to me looking for help. It's usually because they're getting in trouble or something else that leads them into treatment. But on occasion when they do come to me, what would be, I guess maybe the questions maybe for Heidi or Jim, best appropriate. What would be the first step that you'd suggest for someone who's maybe actively using? Because I'll often either call the emergency room and ask them if it's appropriate to get evaluated there, or even call a drug and alcohol specialist and try to get them in to see them. But oftentimes it's quite a long wait, as Heidi mentioned, to get people in. So what would be or even for family members who have someone who's actively using, what would you suggest that sort of be the first step to getting them treatment?
I always tell people to have them call us. Even if we have a long wait list and we can't get somebody in right away, somebody will take the time. Somebody. Can you hear me? Yeah. Somebody will take the time to speak to. Oh.
It is on. Long distance mic.
That's hers. Hello. Yeah, see. Somebody will definitely take the time if you give your patient, client, our information, and I have a lot of these rack cards here, and I try to get people to go out in the community and put them in places, as frequently as possible, but I brought quite a few, so if you want to grab some, you can. And we always have somebody on. My facility is 24/7 because of the residential piece, so I have somebody awake 24 hours a day, and I do drive-bys, make sure they're awake 24 hours a day, or call 3 o'clock in the morning. Oh, by the way. So there's somebody there that can answer the phone and give them some information. In lieu of that, I have this handout here as well, which is the New Hampshire treatment.org website, which people can go on the internet and they can get a comprehensive list of different treatment providers in the state of New Hampshire. And this is a good resource. But people are welcome to call Southeastern anytime, even if we can't actually provide the service. We have a long list of numbers, we give people phone numbers, and we're more than happy to refer to other facilities.
Thank you. It's an excellent question, and it's one that we hear from a lot of providers that first, did you have anything else, Jim, to add to that answer? A skilled assessment is one of the most important places to start.
As a physician, one of the things that we need to be careful of, especially if it's alcohol, is that alcohol can actually lead to seizures. So if a physician or family member believes that it progressed to a place of being an addiction, is that they need medical care. Because not very likely, but likely they could seize if they go into withdrawal. So there needs to be a medical component with that. If there's any suicidality at all, any death wishes, those sort of things, certainly those are things that we at the ER get a lot of. Because what that does, it kind of gives them, they get a mental status exam. We can test, kind of see where they're at suicidality-wise, safety-wise. It also tells us where they fit as far as the diagnosis. There's also, Chris, you might know this, what's SBIRT stand for?
Screening, brief intervention to treatment.
Yeah, that's something that actually the state has,
Yeah.
that you can actually do that in a primary care office. So look into that as far as it's something happening within your office. Also, the New Hampshire treatment.org, the way that works is that you can go there, and if you're looking for, like, say it's an assessment or a private practitioner or an inpatient, you can actually, that's one of the, you click the box, and it'll give you all the places in the state that you could refer to. I think if I were a primary care and somebody had a substance abuse disorder, I would actually look for an assessment from a LADAC to at least see if, and maybe it's nothing, but it's better to check it to see if it's actually there, and then to do nothing, and then it does become a problem later.
Thank you. So if you are interested in practice-based stuff, talk to me. If, and for other folks, you're really looking, what you're hearing is a skilled assessment, someone with some expertise in this. If you do go to the newhampshiretreatment.org, you will get a huge number of responses for who can help you with that. And if it's overwhelming, give Southeastern Services a call. They can help you sort through which of these folks might be the best for me. So you're now in the secret club of knowing where to find that really expert information. Other questions for folks? Yes, ma'am.
Thank you. I'm cheating because I'm on the committee. Susan Nolan, member of the Newmarket Community Church. Heidi, thank you for your work. I have great concerns about the people who do not have health insurance, who are struggling with addiction. And 12 beds is so sad for the whole county. What happens to the person who has no health insurance, which is likely to be that person falling down, in their drug addiction? What happens to them?
Thank you. It's an excellent question, and I'll give a brief answer, and then Chris, maybe you can fill in where I left out. So that is a challenge. New Hampshire can treat 6% of the folks in this state who need treatment. We are second only to Texas. It's not as huge of an issue as you may think, because the best state in the country can only treat 20% of the need. So first of all, if you don't have insurance, we're going to recommend that you find a provider who takes folks who don't have insurance. Any one of your community health centers is the right place to start. That's the first phone call. If you are eligible for Medicaid or expanded Medicaid currently, you will have a substance use benefit if you're on expanded Medicaid. We are hopeful that if we can make that expansion permanent, it will come with that substance use benefit for folks who are on traditional Medicaid, which is available to folks who are low income as well. So no insurance, first step, find a provider, most usually at a community health center.
Yeah, I was just going to say a big part of that whole thing is expanded Medicaid. And if you can talk to your politicians to make sure that keeps going, because it's vitally important, because part of that is a substance abuse treatment component as well as recovery. Right now, there's about 46,000 people on expanded Medicaid in New Hampshire, and if it keeps going, it'll be up to about 125. And so not the best case scenario. Your concerns are absolutely right. We don't have enough treatment in New Hampshire, and so being on the Governor's Commission, that certainly is a concern that we're working on.
I collaborate with a lot of private practitioners, and we really care about people with addictions. And don't be afraid, if you don't have any insurance, to ask for a sliding fee scale. Everyone I know of has one, to the point of zero. Just some pro bono stuff, especially for just the assessment, because we've seen what's happened if people just keep putting it off, becomes a bigger problem. So, newhampshiretreatment.org, look for a private practitioner, and don't be afraid to ask them. Can we work something out? We can't barter, that's against the law, but, can we sliding fee scale or something, okay? So don't be afraid to ask that.
I have a question that I think is going to be best answered by our law enforcement folks. What are the penalties for possession of opiates without a prescription, and what sort of follow-up programs are available?
So for prescription pills, we encounter this quite a bit. When someone is caught with pills in a Sucrets box, and they say, no, I have a prescription for that. I just decided to carry it in my Sucrets box. Well, you're under arrest for that, and we do enforce that law. If it is a prescription pill, depending on the schedule, if it's 1 through 6, and it's the DEA schedules drugs, 1 being the most dangerous, down to 6 being the least dangerous, based on the schedule of the drug that you're in possession of, determines whether it's a felony or a misdemeanor. For example, if I am in possession of someone's OxyContin, now it's a prescription pill, but it's still a narcotic. It's a dangerous drug. It's a Schedule 3 drug. So that would be a felony. If someone is in possession of something like Xanax or some type of other prescription drug that's not a narcotic, they would be charged as a misdemeanor. And Tori, I missed your follow-up question to that.
I think that you answered it.
Okay, thanks.
Any other questions?
Hi, my name is Cleo Castengay, And I'm with the Society of St. Vincent de Paul in Exeter. Newmarket is not in our catch area. But anyway, one of the things that you have not said tonight, which we see, is that where do they get the money to pay for this? And what's happening is from their rents, is from their car payments. And that's where we see them. And so they're about ready to be homeless, and they come over to us. And so we're seeing more and more of that, and that's why I'm here tonight, to find out how to help. Because we stop evictions right off the bat. There's no reason why these kids, and they can't go to their landlords. You know, so it's a really ticklish problem. And so we stop it, we fix them up, and then the first thing, of course, is how do we get them help? So I thank you for doing this. Haven't seen an Exeter. You and I have got to talk, and thank you a lot.
Thank you. Saw another hand back here.
Mike Hall. Quick question for you. So you talked about positive peer pressure. I forgot who had mentioned it. So I've got twin boys that are in the 6th grade. So they're 11 going on, I like to say 18, but 12. And so I'm just wondering, is there anything in the school, and Chris, you may know this, any organization in the school that could actually help with this before it gets started?
I think we're waiting for a question for what the school's role and responsibility. I think it's a great question. Where do I face?
Who are you?
Oh, I'm sorry. I'm Chris Mazzoni. I'm the assistant principal of Newmarket Junior Senior High School. It's a great question. I think one of the things we struggled with at the coalition meetings was exactly what the school's role was going to be. And it's to ask you as parents what your role is going to be. And it's to ask you to listen to the things that we know work. So the first question, Mike, I think you asked was about peer role modeling and appropriate. The best program that we have going with kids, and we have some standalone ones that are phenomenal. Youth to Youth is one that comes to mind, is relationships. So for a half hour every day in our building, we stop what we're doing to get to know our kids. They're not our friends, and your kids aren't your friends. And that's probably the number one thing I would tell you. We ask them who they are, what they do, what they like, what they don't like. And when you're a parent, you can ask them what time they're going to be home. If you don't like the people they're hanging out with, they don't have to go. If you don't like the answer they give you, you can tell them to stay home. You put the gas in the car, you give them the keys, you pay for their insurance. You are not their friends. The best thing you can do for your kids is not be your friends. You can love them, you can care about them, but don't be their friends.
Yes, ma'am, and back. If you have time for one more, and I'm going to cover a few of the written ones. Thank you.
Real quick, given the information regarding prescription drug abuse, and that being the first addiction site for many people, what can be done coming at it from the other direction, controlling the amount of opiates that are prescribed, how multiple prescriptions for the same person? I mean, what can be done from that side?
Sure, that's an excellent question. And
I can talk about a little bit of that. In New Hampshire, well, first of all, the prescription monitoring program that just went online maybe a year ago, not quite, could certainly address that, where physicians have to put into a database of, that they're given prescriptions to so-and-so, and other physicians can go in there and make sure that that person's not getting it from 4 or 5 different places. The problem with that is that it's not mandatory. Either physicians can choose to use it or not. But it certainly will help. In a 3-month span, I think it was in June, July, and August, 13 million prescription painkillers were given out in the state of New Hampshire. 13 million. Certainly a problem, and it's going to take your voices to change that, quite honestly, from a couple of, from a political standpoint and as citizens.
There is a big conversation right now at the state level, especially with the Board of Medicine, around how they can help fix this problem, because they recognize their culpability in it, not individually, but as a group of professionals who really worked hard when these new tools that were narcotic pain meds came out, to use them and to help people with their pain. So there's definitely the prescription drug monitoring program that we're really encouraging providers to use, and everybody in here, the next time you see your provider, could say, do you participate in that? Do you know what it is? If you don't, how come? But I think it's also important for all of us to recognize that we are responsible for our own use as well. And to have that conversation with our providers before you get hurt, because chances are if you do get hurt and you do need prescription meds, you're not going to see your primary care provider. You're going to see somebody else. So having a conversation at your next physical, at your next women's appointment, the next time you go in for a flu shot, what's your strategy to manage pain? That's what today is all about, is that just start talking. It's just starting that conversation. How do I manage my pain? What do we do? And when is it appropriate to bring in expertise? We're talking a lot tonight about what to do when folks are in such deep trouble that they need really significant help. There are lots of opportunities for many folks prior to that point to get some help. So one of I think I have 3 or 4 questions here about what is Narcan, what's the relationship between Narcan and heroin and other opioids and heroin. So in a nutshell, in your Anatomy 101, I can answer those tonight most quickly by saying opioids work on receptors in your brain. They're tiny little spots that really like to be pressed by things that, when they do get pressed, you feel good. Dopamine is one of those things. You've heard the term of a runner's high, the chemicals that your body generates when you run. I have no experience with this, but I've heard it happens. When you run, those chemicals are kind of created, and they hit those little spots in your brain. And your brain goes, oh, that's awesome. Heroin does the same thing. Prescription opiates do the same thing, because the side effect of hitting those little buttons called mu receptors is you don't feel pain. It's that part of your brain where you can press the button if you're a little chemical in there and you don't feel pain. Prescription pain meds press that button. Heroin presses that button, but heroin's a lot cheaper. That's the relationship. Narcan fills the button so nothing else can get in there. It's naloxone hydrochloride. It is a substance that is not addictive. It's a very benign substance. It's one of the few in the universe that won't make you fat, dizzy, or kill you. But it kind of sits on those little buttons and does not let prescription medication in there, any opioid at all, or heroin in there. So you wake up from whatever high you were having, very unpleasantly usually. But if you have heroin in your bloodstream, if you have heroin circulating in your brain, and you get Narcan in there, the Narcan out of the way, I'm sitting down, and you can't process the heroin anymore. That's how Narcan works on those little buttons. So I think, thank you everyone for those fantastic questions. If you have more, please write them down. We'll give you some other information about where to leave them or send them. But what we do want to do is take a few minutes to respect your time and look at next steps, both some suggestions for what you could do personally and what we're doing in this area. I feel like am I using both? I know. If you're hearing an echo, it's me, not you. As folks have mentioned tonight, if you're looking for resources, drugfreenh.org. We always get the, what if you don't have a computer? What if you don't have a telephone? What if you don't have a... If you don't have those things, we have other resources for you. These are the resources that are most easily accessible for folks, drugfreenh.org, where you can get some suggestions about what are some of the other signs and symptoms to look for. We talked a lot about the behavioral signs and symptoms of youth. Many of those are very similar to the same signs and symptoms you would look for in folks who are older. NewHampshireTreatment.org will also give you a big long list of inpatient, outpatient counselors, LADACs, alcohol experts, substance use experts. If you need help navigating that list, you can always call your provider. You can call Southeastern Services. We have Bonfire Recovery Services here for you to visit. They are experts in the recovery realm as well and what is available to you. I want to encourage folks to visit the folks around the outside of the room tonight who have brought their resources and their expertise to us and to you. In Newmarket, the Alliance for Substance Abuse Prevention Community Coalition continues to meet. If you have an interest in that, you can meet anyone with a name tag. let us know. As we wrap up from this event, we're talking about what else do we need to do. And a lot of what we need to do depends on what you need to hear. What do you need to hear? What do you need to know? And how do we get that to you? So this has been really fantastic, and we thank you so much for coming out and sharing your concerns and your concern just by being here. It's really overwhelming, as some folks have said, and very reassuring that all the work, we've been meeting weekly for a while. I don't do laundry weekly. So that's a big deal. That's a big deal. The goal of this evening was let's start talking. Let's keep talking, moving forward, and let's keep talking. And for folks who said, how do I have this conversation with my kids, with my mother, with my grandmother, with my Uncle Bob, it's Thanksgiving, oh my gosh, it's going to happen. A few suggestions for you. If you take nothing else from here, if you I have 18, 12, 10, and 7. There are a lot of awkward conversations in my house. A lot of them happen in the car, where we are both facing forward and no one needs to make eye contact. I recommend that as a, what do I do? Get in the car, go to ice cream. Who wants an ice cream? Come on, let's go get an ice cream. Dog, kids, it works. And the other thing that I saw someone talk about that's so true, sometimes it's breaking the ice. And it's an important conversation to have. How do you have it? You have a choice. We're going to have dinner tonight. We can talk about sex, or we can talk about drugs. You come back and tell us how many people choose sex. So you now know you can go home, and you don't have to have a conversation about sex with your kids, but we really would ask that as the holidays come, and you spend time with people that you love and who are important to you, that you take away from here some of the work that we've done to those people, to your family, to your friends, and you love them back and have that conversation. If you can't say sex or drugs, you say, how are you? How are you? How are you? And if that goes to sex, I got nothing for you. But we are going to offer some naloxone kits, and to get those tonight, the state has provided free naloxone kits for folks who are concerned about themselves, a loved one, or a family member or friend. In order to receive those kits tonight, we do have a 10-minute training. So it really is appropriate for folks who feel like, I have a really real 1 degree of separation concern. They're available by prescription from your provider. The state did, and the legislature in May passed some laws that say providers can now write prescriptions for naloxone to people who aren't necessarily the intended users, and we don't do that with prescriptions. So we would invite folks who are interested, if you want to hear that training, feel free, you're welcome. But we will be asking folks who are interested in picking up a kit to spend some time with us, about 10 minutes of your time to do that. So the other thing someone had asked about, what other steps do we do? You need to vote. You need to have this conversation. Let's start talking with ourselves and our families and our loved ones. Let's start talking with our legislators. A budget is a reflection of your philosophy, of your opinion about what's important to you. If you can't talk with people you really care about because this is uncomfortable, talk to the legislators. Drop them an email, give them a call. Say, how can you help us? Budget season's coming up. Yes, sir. Yes. Thank you. And we'll end on their, hopefully, consideration of our...
Speaking for the two of us, we definitely support Medicaid expansion and further budget for this crisis and other things for the health of our community.
We are going to be faced with a vote to keep Medicaid expansion. It's going to come up during this legislative session. The more you can reach out to all your legislators and make sure that they support Medicaid expansion. The difficulty that we have is there are a number of legislators who are opposed to Obamacare, and they see Medicaid expansion as an aspect of Obamacare or the Affordable Care Act, and they don't want to support it. But as you heard already, we've been able to extend health insurance to individuals earning $15,000 or less. We now have been able to extend that health insurance to 48,000 individuals in this state. We do not want to take that away from those individuals, and there are more individuals left to sign up. And again, what we need to do is reach down. That's for people earning from $11,000 to $15,000 who have not been on Medicaid. If you're less than $11,000 and you're a single mom, or some other low-income individuals, you're on Medicaid now, but you don't get the substance abuse coverage that expanded Medicaid provides. So we need to also make sure that we find a way to extend that coverage to everyone who's on Medicaid, whether it's straightforward Medicaid or the expanded Medicaid. But we are concerned that we're not going to get that legislation passed. So if you know other legislators in the area, you need to be talking to them and telling them how important it is. We're also looking at other ways to try to provide expanded treatment. There are some additional grants coming in from Washington that are going to be able to help a lot of our community health care centers. So that's really important as well. And New England and the Midwest are having the greatest problem with this issue, but it's all over the country. And the other thing we're trying to do is work with our federal delegation to get the federal government to recognize that this crisis is as important, more important than you think where we were a year ago talking about Ebola. And that hasn't happened. And we need to make that conversation happen so that the federal government is able to step in and provide some additional funding so we can get the facilities that we need in this state that we don't currently have.
Also, I'd just like to say that tomorrow night I'll be at Exeter High School talking to parents about current trends and recognizing and addressing substance abuse issues with teenagers. If you ever have any group that wants me to come and speak and talk about that, I do it for free, and I'll do it. I love talking. I love talking about this issue, and I'll come wherever you are to help you with your teens, because there's definitely things that you can be doing.
Thank you, everyone. I want to take a minute to ask you to fill out the surveys that hopefully you have either retrieved from underneath your backside or are still keeping safe and warm. That will help us know what else we can do for you moving forward. Do want to take a minute to thank the Lamprey Healthcare for their support of staff and subject matter expertise here. To the city of the town of Newmarket, thank you. To Newmarket for their support with the rec center and staff, and to you all as community members who are here, you students of substance use, thank you very much for coming out tonight.
Thank you, everyone.